So I'm Matthew Gaskell. I'm a consultant psychologist and a clinical lead for addictions with the Leeds and York Partnership NHS Foundation Trust, and I have a role as the clinical lead for the new NHS Northern Gambling Service, which is a new service covering the whole of the north of England with clinics in Leeds, Sunderland and Manchester. So there's been an NHS clinic in London for over 10 years, but the NHS is now expanding, and obviously now with our three clinics in the north of England, it's really a reflection of the deep human suffering that comes along with gambling addiction and all the associated harms. These problems are always best seen on a continuum from, I think, in terms of trying to prevent harm all the way through to very serious harm. So the NHS positions itself at the more serious end of that spectrum, where individuals are struggling with gambling addiction and their families are struggling with a lot of distress as well. Obviously these problems affect not just the individual but the family system, I'd also argue the local community and society as a whole. So the NHS with its professions and specialists are in this space to really look after people who've got problems such as high levels of, we tend to see people who are suicidal. The majority of our service users are suicidal. They've had previous crises. They may have pre-existing mental health difficulties or mental health difficulties that have arisen out of the gambling addiction as well. Problems in relationships, problems with employment. In some cases there's criminal justice problems. Also it's important to say that there is an association between gambling addiction and suicide. There's been too many cases that we've heard of in the media. I've met too many families now where it's very obvious that that gambling addiction has been at the core of those tend to be young people taking their lives. This is a serious problem with deep human suffering. So I'd also like to talk a little bit about addiction and gambling addiction. Addiction tends to be defined as a reward-seeking behaviour that's pursued, which causes negative consequences, and those individuals pursue the behaviour despite those negative consequences. There's a sense from the person of a feeling of a loss of control. That's what they tend to describe. The repetition of the behaviour and the reward system tends to produce a sensation of strong, intense cravings towards the behaviour. Clinically, you see individuals who are extremely preoccupied, that every thought is around engaging in that behaviour, thinking about it in advance, anticipating it, strong sense of anticipation, engaging in the behaviour and all the reinforcement that comes with that. And then subsequently to that behaviour as well, as usually reflecting back on it or anticipating the next occasion as well. So those are some of the features. We tend to also see people who would describe trying to reduce the behaviour, stop the behaviour, and having great difficulty to do that. That's usually another defining feature. So those are some of the areas that you think about in terms of trying to define it. As I say, it's generally seen on a continuum. These sorts of cases tend to be the more severe end of that continuum of harm. Thinking about gambling addiction, because traditionally we think about ingesting a substance or alcohol, of course. So is gambling different? Well, in my experience, it's incredibly familiar territory. When I'm listening to cases, I'm hearing exactly the same kinds of patterns. Not every gambler, of course, is the same. That's important to say, and it's important to say that most people can gamble without harm. Gambling addiction to me is extremely similar to other addictions. So I like to say addiction is working on different levels. It's not just an individual level. You're also looking at the environment. You're also looking at some social factors, and we're also interested in the behaviour itself, or the gambling product, which is akin to the addictive drug that is often spoken of.